Hi there, welcome into Dr. Caitlin's office. Do you have an appointment with us? Okay, what's your first and last name and date of birth? Okay, and your appointment time? Perfect, found it. And then what do you need to be seen for today? Okay. Have you had any cough or fever in the last 2 weeks? Okay. And then have you been out of the country in the last 30 days? And where did you go? Ooh. I bet that was fun. Okay. Alrighty. And then you are a new patient with us, so I do need to go over some health questions, okay? Okay. Are you on any daily medications? Okay. And, oops, 1 second. Okay. Okay. Do you have any history of high blood pressure, high cholesterol, anything like that? Any history that we should be aware of? Okay. And then what about family history? Okay. Is that on mom's side? Okay. Anything on dad's side? Okay, perfect. Alright, let's see. Okay. Alrighty, well we can start your exam. So we're just going to do a full physical just to make sure everything is good. And because you're a new patient, it's going to be very thorough, okay? Perfect. Alrighty. Okay. First I'm going to put on some gloves. Yes, I got pink gloves. I love them. They're so pretty. Okay. Oops, wrong hand. I can get them on. Alrighty. Oops. Alright, perfect. Okay, so we're going to start with some basic vitals first. Is that okay? Alright, so at first I'm going to go ahead and take your temperature, okay? So just hold still. Okay, I'm going to get your temple, okay? On the other side. Okay, 98.7, that's perfect. Alrighty. Now I'm just going to listen to your heart and your lungs, okay? Get my things on the right way. Okay. Okay, this might be a little bit cold, okay? Okay. Alright, I'm just gonna move your shirt to the side, okay? Okay, just breathe normally for me. Okay, your heart is sounding good. Okay, that sounds good. Alright, now I just need you to take a big deep breath in, okay? Ready? And let it out. Okay, again, big deep breath in. And let it out. Deep breath in and let it out. Once more, deep breath in and let it out. Okay. That all sounds perfect. Lungs sound good. Heart sounds good. Okay. Now what we're going to do is take your blood pressure. Right? Okay. I have this blood pressure cuff. Okay. Have you ever had your blood pressure taken before? Yeah. It just goes around your arm up here and it will give you a big squeeze, okay? Okay. Alright. Do you have an arm preference? No? Okay. Alright. Can you uncross your legs for me? Great. Okay. Alright, and I'm going to place this right here, okay? Alright. Okay, you ready? Okay, once more, okay? Okay, perfect. Your blood pressure was 114/70, so that's perfect, okay? Put this back around. Just gonna take this off, okay? The rest of the air. Okay, perfect. Alrighty. So, now I'm just gonna hold on, let me put your vitals in the computer. Okay. Heart rate is good. Lungs are good. Blood pressure 114/70. Temperature. Alrighty. Okay. Now I'm just gonna kind of feel around your face, okay? So I need to move my coffee out of the way. Okay, I'm gonna take this off. Okay. Alright. Now I'm just gonna kind of just feel around your face. Feel your gland, your lymph node. Just make sure nothing's swollen, okay? Alright, again, I'm gonna touch you on your face, okay? Alright. Do you have any tenderness in your face? Alright, let me feel your lymph nodes. That all feels good. Alright, right underneath your ear. Okay, I don't feel anything swollen, so that's good. Any pain? Okay, good. Alright, and then what about your sinuses? Just gonna go right between your brow bones. Any pain there? No? And then right here underneath your eyes. Any tenderness or any pain? Okay, perfect. Okay. Okay, that all looks good. Okay, next I'm going to move on to your eyes, okay? So I'm going to bring in a light. This light right here, so it will be bright, okay? So just look straight ahead. You can look at my nose, anywhere on my face, okay? Don't look at the light. It's very bright. Alright, ready? Okay. Okay. Just seeing how your eyes constrict and dilate. Okay. 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 Alright, I'm going to do the other side. Alright, stay looking over here. Ready? Okay. Alright. Your left side is looking good as well. Alrighty. I'm going to place my hand in the center like this, okay? And I'm just going to go back and forth just to look, okay? Alrighty. Ready? Okay. 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 That looks good as well. Now I'm just going to see how your eyes track the light. Okay, so I just want you to follow this light. Okay, alright, start here. Okay. Good. Just follow it so I can see how your eyes track. In, out. Corner, corner. Okay. Okay. Alright, your eyes are tracking. Good. Okay. Now I just want you to look all the way up. Okay? Just look all the way up. And I'm going to shine the light, but don't look at the light, just look up. Alright? Alright. Look up, look up, look up, look up, look up, look up. Look up, look up, look up. Okay, that's good. Okay, now go ahead and look down. Look down, look down, look down, look down. Look down, look down. Look down. Okay. Now look to your left. Look to your left. To the left, to the left, to the left. To the left. To the left. Okay, now to the right. Look to the right, look to the right, look to the right. Good, 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 good. Look to the right. Okay, now look back at me. Now once more without the light, okay? Alright, I'm just gonna look. Alright, ready? Look up, look up, look up, look up, look up. Look up, look up, look up. Okay, look down, look down, look down. Look down, look down. Okay, look to the left. Look to the left, look to the left. Okay, and look to the right, look to the right. That looks good. Okay, and then back at me. Good. Good. Okay. Alrighty. I'm gonna put the light away for a minute, but I will bring it back out. Okay. I have this tool right here, and I just want you to look at it, okay? Just look at this tip right here and follow it in, okay? Follow it. Good. Good. Okay. Perfect. Good job. Okay. Alrighty. That looks good. Okay. We're gonna move on to some colors, okay? Let me put some of this in my computer. Okay, eyes. Tracking good. Eyes are dilating and constricting like they should. Okay. The whites of your eyes. No redness. Okay. Alright, now we're going to move on to colors, alright? Alright. Okay. So what color is this? What color is this? Pink? Okay. And what color is this? Blue? Good. And what color is this? What color is this? It's like a light green. Yep. And the last one. What color is this? Yellow? Perfect. Good. I really like the sound, the way it sounds. We'll use these when we get to your ears, okay? Alrighty. Okay, and then this is the last portion of the eyes, okay? Alright. I just want you to tell me when my fingers come into frame. Okay, so look straight at me and then tell me when they come into frame. Okay. Alright, here we go. Ready? Good. 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 Great. Perfect. Good. 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 Perfect. Alright. Now, what we're gonna do is we're gonna move on to your ears, okay? Alright. So I'm gonna bring in a light and I just want you to turn your head all the way to the right, okay? Turn it all the way to the right. All the way. Okay. Just gonna look in your ear. I'm just gonna look in your ear and see if there's anything concerning. I do see some wax, but that looks okay, just a little bit. Not too bad. Okay. Alrighty. Now go ahead and turn your head all the way to the left. All the way to the left. Okay, good. Alrighty, let's have a look in the left ear. Okay. Okay, I see just some more wax. It's a little bit more than the other one, but still nothing too concerning. Okay. Alright, your ears look good. Excuse me. Okay. Alright, now we're gonna do a little bit of a sound test, okay? So, I just want you to close your eyes. Close your eyes. And then tell me if you can hear this, okay? Good. 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 Perfect. open your eyes back up. Give you a little break. Okay, now we're going to do the same thing again, and I just want you to tell me how many times you hear the click. Okay? Alright. So close your eyes. Close your eyes. Okay. Here we go. How many times? Good. Perfect. Good. Just one, yep. Good. Perfect. One more. Great. Go ahead and open your eyes back up. Good. Okay. Alright, so we're going to do the same thing, but this time I'm going to whisper a word, and I just want you to tell me what word I say. Okay? Alright, so go ahead and close again. Close your eyes. Alright, you ready? Relax. Okay, what word did you hear? Good. Alright. The next word is physical. Okay, what word did you hear? Okay, alright. 2 more times. Go ahead and close your eyes. Close your eyes. Okay. Okay, next word is butterfly. Okay, what word did you hear that time? Good, alright. Last time, okay? Last time. Close your eyes. Okay. Banana. Okay. What word did you hear? Perfect. Okay. Well, your ears seem perfectly fine, okay? So that's good. Okay. The next portion of the test, well actually, hold on, let me put that in my computer. Alright. Okay, just hang tight, relax. Okay, ears are good. Just a little bit of wax. Okay. Can hear clicks. Alrighty. Okay, so the next portion is kind of like a muscle test, is the best way to explain it. I'm going to push on your face, and I want you to try and resist, okay? Alrighty, so we'll start on this side, okay? I'm going to push, and you try to resist, okay? Alright, don't let me push it. Okay, good. And then same with the other side. Ready? Don't let me push it. Okay, good. Now we're gonna do your eyes, okay? I'm gonna try and don't let me open them. Alright. Ready? Don't let me open them. Okay, perfect. Okay, now let's do push on your shoulders, okay? And resist, okay? Ready? Okay, ready. And try and shrug them. Okay, perfect. Alrighty. So that all looks good to me. Let me note that down. Okay. Okay. Alrighty. Next, I'm just gonna palpate on your face and on your chest. Alright? Okay. Here we go. Just sit still. Ready? Do you have any pain? No? Okay. Alright, let's move to your chest. Okay. Alright. We are coming to an end, so I just want to take one more look at your face. Just one more look at you, okay? And then you're free to go. Alrighty. Okay. Alright, so just sit still. Just look in. See if there's any abnormalities. Oh my goodness. Abnormalities. Okay. Just look at your chest. Okay. Down your arms. Okay. This one. Okay. I'm gonna look at your tummy, okay? So can you just lift your shirt up just a little bit? Okay, perfect. Alright. Alright. And then let me look at your legs. Okay. Alrighty. Everything looks great. Your physical, perfect. Did you need any kind of like documentation for work or anything like that? You do? Okay. Let me type that up and I'll get that printed for you. Okay. Alright. Okay. And print. Okay, so they will have that in the front for you when you check out. Okay, I do recommend booking a eye appointment with an eye doctor just to get a more thorough eye exam. Okay, and then as well as a dentist. I know we didn't check your mouth today, but I would go ahead and find a dentist and make an appointment. Okay, and also you can come back in 6 months and maybe we can do a cranial nerve exam if that's something you're interested in. Okay. Alrighty. Well, you are free to go. And it was so nice seeing you today, and welcome to our clinic. Okay. If you have any questions, any concerns, anything like that, don't hesitate to call us, okay? And we will see you for sick appointments and all that. So you don't need to go to like an urgent care or anything like that. Okay? Just give us a call. Alrighty. Alright, well you have an amazing day, okay?